Assalamu alaikum friends. So today I have a new topic for you, though it is not very important for your exams, but you very quite often you find it in your clinical practice and it is important in your clinical practice. So to start with the case today, the today case is 50 years old female patient. So a female patient, she had fracture of the right femur. But there is one thing we need to concentrate in the history is patient has history of pain prior to the fracture. So patient has pain in the right thigh for past 2 weeks. Before patient had episode of fracture, she had pain in the fracture side. So, and second thing is patient has history of breast cancer, which was treated around 5 years back. So this direct you towards the diagnosis that there is some ongoing pathology inside the bone which is painful and it damaged the bone and finally resulted in fracture. So this is the presentation of patient who have pathological fracture. So how will you define? So pathological fractures are fracturing occurring secondary to the altered skeletal physiology. Either there is change in the physiology of the skeleton or mechanics, that is strength of the bone. So it may be associated secondary to benign or malignant lesion inside the bone. So just imagine the scene where in the old buildings or old doors, there is destruction of wooden bars or wooden doors by invasion with wood mites. The same thing is happening in the same way it is happening inside the bone. So there is something which is destructing the bone and slowly decrease the strength of the bone, and finally one day the bone will give way. So this is how the fracture happens in the pathological bone or pathological inside the lesion inside the bone resulting in fracture. So how will you classify? So to make you easy and to remember the causes of pathological fracture, I simplified the classification. It is due to the primary bone lesions or following some secondary bone lesions inside the bone or secondary to bone tumors. So what are the primary bone diseases? These are the diseases which are either present by inheritance or they are the part of the bone. So example for this one is Paget disease, fibrous dysplasia, and osteogenesis imperfecta. These are the diseases which damage the skeleton of the bone or the build of the bone resulting in the fracture. The secondary bone diseases are out of the course, they develop disease like infection. Infection may be either acute infection in the form of acute osteomyelitis, chronic infection in the form of chronic osteomyelitis. And metabolic lesions, metabolic diseases of bone like osteomalacia, osteoporosis, even secondary hyperparathyroidism or primary hyperparathyroidism also present with pathological fracture sometimes. So then finally comes where bone tumors. Bone tumors are more common causes which causes pathological fractures. Among the bone tumors, we may have benign lesions like simple bone cyst, aneurysm bone cyst, and giant cell tumor, malignant like local primary tumors, Ewing's osteosarcoma or osteochondrosarcoma. The metastatic tumors, this is the more important thing. More important is it's the metastatic tumor which are more commonly causing lytic lesion inside the bone and resulting in pathological fracture. And one more cause to stabilize here or to mention here is multiple myeloma. So this is how you classify pathological fractures, causes of pathological fracture. If you remember this table, it will be easy for you to call in your exams. This slide is very important because you get a lot of questions in your PG entrance exams regarding this. So what is this? One is metastatic cancer is the most common cause of lytic lesion inside the bone or destructive lesion inside the bones in adults. So metastatic tumors are the common cause of destruction of the bone. And the common carcinoma of interest, which spread to the bone, breast tumor in males, breast tumors in females, and lung cancer in males. These are the two common tumors which spreads to the bone and present as metastatic tumor. And to know I mean, how frequent the bone is affected. So bone is the third common structure to involve as a secondary. This is third, whereas lungs is first, liver is second. So lung, liver followed by bone is the common metasite for the metastatic bone disease. And among the bone, spine is more common location for metastasis followed by pelvis and proximal femur. And among the spine, the thoracic spine is the common level where we have lytic lesion due to bone metastasis, bone metastasis. So this slide is very important. Metastatic cancer, common cause. Breast, common in females. Lungs, common in male. Then bone is the third common tissue to get involved as metastatic disease. First is lungs, followed by liver. And among the bone, spine, followed by pelvis, followed by proximal femur. And among the spine, dorsal spine is the commonest level where you have metastatic lesion. Then this point you need to little concentrate and try to follow me what I am telling. Proximal femur is most common cause of fracture. It's not the common cause of secondaries, but it is the common cause of fracture secondary to the metastatic lesion. So common cause of common site for metastasis is spine, but common site where patient develop fracture due to the metastasis is proximal femur. Hope it's clear. So this proximal femur is the common site for the fracture, but the dorsal spine is the common site for metastatic lesion inside the bone. How will be the presentation in metastatic? So this point you need to remember. In routine fracture, patient has fractured followed by pain. But in pathological fracture, patient will have pain first, then patient develop fracture. Then fracture may or may not associated with trauma. Most of the time, it is just trivial twisting injuries of the limb which resulted in fracture, and they may or may not have the other symptoms. Other symptoms mean the symptoms pertaining to the systemic disease or the primary lesions inside the bone. How will you diagnose? So we do X-ray. So how will you differentiate on X-ray the normal bone getting fractured from the bone which is pathological and getting fractured? So these three things you need to remember. One, the bone will be more osteoporotic and pathological fracture. Bone will be having lytic lesion around the fracture site. And third thing is the fracture ends are blunt. They are not sharp. So if you see for comparison, I have got the two X-ray. One is but this is pathological fracture. This is normal bones. Here you can see the sharp end and the bone consistency is same. Whereas here, if you can see, there is a lytic lesion and the bones ends are not smooth. They are blunt. So osteoporosis, lytic lesion inside the bone, and presence of blunt fracture margins or fracture ends diverts you or incline toward the diagnosis of pathological fracture. Then what all other tests you do? We do other tests. This is basically to localize the site of the primary. Either we do CT scan, we do MRI, bone scan, depending on the suspicion of the primary or depending on how the other reports are. Then we do blood investigations like prostate specific antigen for CA prostate, CA carcinoembryogenic protein, and alkaline phosphatase and multiple myeloma profile. And we do biopsy finally. So before doing biopsy, I just want you to remember two rules, basic rules. There are many rules, but these two rules are very important. One is biopsy should not be done unless you are done with all non-invasive investigations like MRI, like the bone scan, CT scan, and everything. Second thing is biopsy better to be done by the same person and the same institute where you have facility of treating malignancies of the bone. We have radiotherapy, chemotherapy unit and all there. Better the case should be dealt by the same person in the same institute. And one thing you need to remember, this may be asked in your exam also, acral distal or distal extremity lesions. That is the lesions distal to the elbow joint in upper limb, distal to the knee joint in lower limb. They are very rarely affected with metastasis. But if you find the lesion in the bones distal to the elbow, like radius and ulna, or distal to the knee, like tibia and fibula, the most common primary will be a lung cancer. So if you find the lytic lesion in distal tibia, distal fibula, or distal radius and ulna, the primary will be most of the time in lungs. So once you have diagnosed, you need to treat it. So before treatment, I just want to put a, I just want to you to know this one. There is something called as Miral's grading system for bone tumors. You just remember this one. Other slide is not so important for you. Why it is important? It was once asked as a PGB in PG interest. What is the grading system for tumors? So it is bone tumors that is for secondaries. Just remember, it's for secondaries. We have different classification system for primary bone tumors. What are primary bone tumors? Just to recall, Ewing sarcoma, osteosarcoma, and chondrosarcoma. So we follow Anaking classification for this one. So Anaking is for primary tumors. whereas Miral's grading is for secondary tumors or metastatic tumors. So once you have diagnosed, you need to treat it. So once you need to control the pain. How will you control the pain? We need to give liberal morphine. Morphine is the medicine we use for pain due to tumors. Then we need to go for prophylactic fixation. What is prophylactic fixation? Imagine a patient of breast cancer coming to the oncologist. On doing bone scan, they found one lytic lesion inside the bone, but it is not symptomatic. Patient is not having fracture and all. So, but it is a lytic lesion, and most if you leave like that, it progress to further destruction and may cause fracture. So, just to prevent the fracture, we will fix it provisionally. This is called as prophylactic fixation. After fixing it, we need to give radiotherapy locally so that the tumor cell will die off. Then the third mode of treatment is immobilization of the feeding vessels. So here what we do is we trace the feeding vessels by radiointensifier. Once we entered into the feeding vessels, we can inject some emboli element here, or so we can even inject chemotherapeutic agents here. Then chemotherapy. This is the treatment of pathological tumors or a patient having pathological fracture or lytic lesion secondary to metastatic lesion. That's all for today. Hope you like the video. Please like, share, and subscribe to the channel. See you next time in next video. Thank you.